If you're not scared about COVID-19, public health officials are doing their best to change your mind.
Some doctors that I've talked to are calling this a tsunami, or others are referring to other terms as a Category 5 hurricane heading our way.
Dr. Osterhold at the University of Minnesota just coined the phrase viral blizzard, and I think that might characterize this accurately.
About 3 weeks ago, hospital admissions in Wisconsin for COVID suddenly shot up to all-time highs.
There is a serious risk that continued increased numbers of COVID-19 cases will overwhelm an already strained healthcare system.
At Marshfield Clinic, Chief Medical Officer Dr. Melms says they're doubling up patients everywhere.
We converted an entire medical floor to an inpatient unit, and we doubled the beds in that unit. We converted our medical ICU into a COVID ICU, and we doubled the beds in that unit. We had to create a new ICU to take care of our other non-COVID ICU patients.
The state actually had a contingency plan for that situation last year called the Alternate Care Facility. It was designed to handle over 500 patients, but never had more than 23 at one time. The state shut it down this past February and has no intention of reopening it now that the situation has changed.
I think while we were very fortunate to have the field hospital and certainly did have numbers of patients need to use it last spring, what we're finding is that certainly patients prefer to receive care as close to home as possible. And as Dr. Melms noted, the issue really is staffing. It is less about brick and mortar sort of facilities that are needed.
And at Marshfield, that means all hands on deck.
We have looked for staff everywhere. We've taken them from the Department of Education, from our quality department, from our care retention department, from everywhere that we possibly can to take care of the demands on our staff.
Despite this desperation, the hospital insists it made the right decision firing dozens of employees who refused to get vaccinated.
In our entire organization, and we have over 12,000 employees, we lost less than 100 employees because of the vaccine mandate. But one thing that did happen with the vaccine mandate is that many of our hesitant employees, thousands of our hesitant employees, did elect to get vaccinated. So it accomplished what it needed to do.
After all, health officials insist that things will only get worse the longer people refuse to do what they're told.
The course and nature of this pandemic has been driven by the unvaccinated.
It continues to be the case that we have the tools available to turn back the pandemic. We just need to use them.
And Wisconsin has yet to really experience Omicron. So far, there have only been about 30 cases in the state. Health officials warn when Omicron really hits, Wisconsin's healthcare system could very well collapse.
It is important that everyone understands that our healthcare organizations have been pushed to the breaking point, and it is quite possible that Omicron will push us beyond the breaking point.
For the McIver Institute, I'm Bill Osmolsky.